But the moment is made for the Moat medic, Dr. Ranjeet Brar, who is a vascular surgeon, as well as a good friend and comrade of mine. But he doesn't speak for the NHS, of course. He's speaking purely in a personal capacity. But my goodness, does he speak some sense? And we've enjoyed his contributions over these last dreadful weeks. Dr. Ranjeet, thank you very much indeed for joining us again. Summarise, if you would, this point. Italy, France, Spain, death rate going down several days in a row. Britain, death rate going up every day. Discuss.
Thanks, George. Pleasure to be with you again. You're right, George. We are progressing rapidly. My brother sent me a little graph. He said a number of exponential graphs that we've all been looking at against time is also going up exponentially. I'm afraid to say we're still very much in a phase of ascendancy, both in the world and within the UK. Looking at the world cases, and we know, of course, these are the tip of the iceberg and only represented tested data, and perhaps we'll come back to that point in a second. But we've gone over 1.25 million confirmed cases in the world. Now, vast majority of those now are in the United States of America, who themselves have 1/3 But in the United Kingdom, we have we have 50,000 cases, of whom we know that 5,000 have died, and that still represents a very large mortality figure. We've said for a little while that we've been probably 2 weeks behind Italy in terms of our curve, and despite social distancing, which the population are doing their best to comply with in difficult circumstances, where economically many are challenged and unable to fully comply with that increasingly hard line put down by the government, numbers are still rising, and we've seen record numbers of deaths over the last 2 days, on some days surpassing, as you say, France, surpassing Italy, surpassing Spain. So it's a very worrying time for our health service, and we're really feeling that strain on the front line.
Yes, I mean, I'm seeing videos of people breaking down, coming off the front line after their shifts. A number of your colleagues have actually perished. In some cases, it's said that they perished because the personal protective equipment had not been made available to them. I saw a missive on Twitter, I think, today from a nurse who says that she's working on a COVID ward, and all she's got is a plastic apron and a paper mask. This is intolerable, surely.
It's an embarrassment, George. I was contacted by Press TV to come on the air and talk to them about the fact that actually doctors across the country have been asked to take down social media posts. Everyone's on social media these days, including doctors, and they've been posting about their frustration and annoyance with the lack of PPE, but also the inadequate protocols for PPE. And several weeks now, it must be 3 weeks ago, we discussed the fact that China had published in English, so not for themselves, but for our benefit in English, the summation of their experience in dealing with the Wuhan epidemic, which included organization of hospital and appropriate levels of PPE. But I'm afraid we've been very slow, partly through a sense of cultural superiority, partly because of hostility of our ruling class, which filters down through our academia and even our medicine, that we don't take China seriously as a purveyor of good information, good data, good quality products. In a way, China's far surpassed that point. They've proved that just by being the workshop of the world and manufacturing those products. But still, there's a certain reluctance to take on board the lessons. I think that will not be the case at the end of this pandemic. I think my own colleagues are increasingly looking towards the information gained from China. I have a sister-in-law who works in the States. She told me there was a mass call of 9,000, conference call of 9,000 of their top medical personnel between themselves and China in order to learn from China's experience. But I'm afraid, due to the NHS being run down, due to our protocols being out of date and very slow to catch up, due to our managers not being clinical and not realizing exactly what we're facing. It has been an embarrassment. My wife, who's currently on maternity leave, but is also a surgeon at a local hospital in London, has gone to the point, she's been so worried, of coordinating donations. And these donations have been coming, and it's heartwarming to see how the British population want to help and value the NHS. But donations from our children's school of goggles that can be used at the NHS, and from a local builder of the full protective equipment that they use for spraying, can be used by the NHS staff. So there is still a desperate shortage. I saw a press piece that Virgin had flown back a whole bunch of protective equipment donated by China. So China are trying to help us. Virgin, of course, have their own axe to grind. They're using it as a PR statement in order to try and encourage us, the public, i.e. the taxpayer, which will be the poor once again bailing out the rich, to give them a massive $7 billion to bail out their industry, which I'm opposed to. So there's a conflation there. But I'm afraid to say some hospitals, the best hospitals, the biggest teaching hospitals, not exclusively, but some of them are doing their best to put in place modern PPE and acquire it. There's a large number of interfaces, and particularly if you go into secondary care, tertiary care, GP services, care homes, there's an almost total absence of adequate provision. And of course, frontline staff, we're increasingly realize, doesn't just mean people within the NHS. Frontline staff means logistics, it means lorries, it means people in the food industry, people in factories that are still operational. And all of these people have been failed in terms of the protective equipment that they have been given, and their inability in their daily work routines to actually adequately self-isolate. And all of that, of course, will have an impact upon the numbers who are dying. And maybe I'll leave it there for now, George, but we can perhaps return to the question of data, because there still is an undercurrent of people who don't seem to believe that there's a genuine reason. And despite, I think, a mishandling from our government, which filters down, and despite the NHS being very run down, we do have to recognise it's a very real situation, and it is in the interest of all working people to take it very seriously.
Yes, I made the point earlier on your last point about the PPE that my mother of 85 has had to, so therefore in a high-risk group with one or two, not serious, but one or two underlying health problems. She's had to shut the door on the nurse and the social care that came to her every other day because none of them have got so much as a mask or a glove or had a test. So she has to make a choice between being in total self-isolation. Even my sister can't, she has to leave the groceries on the door. Being in total self-isolation, or let healthcare workers in that don't have any protection and may very well, God forbid, kill her. The social care Cinderella is even worse, actually, than the NHS.
It is, and not only has social care been means tested and run down, so it's been a deep source of embarrassment to me as someone who really values the ability to treat anyone who turns up at the door, to give them the best care we can, and never have to charge them, never have to ask them about their personal circumstances, whether they can afford to pay. It's a deep sense of shame that patients have had delayed discharge from hospital for the last many years, easily 5 to 10 years, while we go through a process of means testing them, seeing what health, what social services and social care they can receive at home. And having got a patient through the worst of their illness, we're unable to put them very often in a position where they're actually able to carry on, continue to recover, and look after themselves at home. And I'm afraid to say that the legislation that's put in place around COVID-19, which was put, don't forget, before any reasonable health preparations to take care of staff or patients was put in place, also provides for
Doctor, let me interrupt you to give you some breaking news. It's been reported that Boris Johnson has been taken into hospital, having tested positive with COVID-19 last Friday. This is quite serious news. Talk to us about what would be happening to Boris Johnson right now? He has been taken into hospital. What's the first thing that'll happen?
Be interesting to know which hospital. Very often it's St Thomas's Hospital that parliamentarians go to, but that may not be the case. One would have to be totally objective and look after him based on his medical needs. I can only presume that the symptom that would have sent him into hospital was either persistent fever and inability to feed himself, and he needs some fluids. It may be that he needs some oxygen if he's short of breath. I obviously have no information, and I'm simply giving you a likely scenario. Were he to need oxygenation in the first instance, that would be non-invasive. But should it get worse enough, it's not impossible that he should have a recourse to or need a ventilator.
Well, now we come to ventilators. Why did we not have enough? Why have we taken so long to get more? It seems incredible to me that people can get tests. Ocado bought tens of thousands of tests for their employees. People in other countries are buying huge numbers of ventilators. Some of the very poorest communities in the world, like Gaza, for example, are actually making their own ventilators. Why are we so desperately short of them, Doctor?
Our rate of ICU beds is very low. It's historically been very low. I told you before, it's not an unusual experience for me if I'm operating on a patient who will need to go to the intensive care. We have to wait till quite late in the day to find out whether that bed is available or not. There is not really sufficient capacity for our everyday needs. Now, this crisis, this epidemic, represents a massive increase in the demand for ventilators. But it's true to say that there were not enough anyway for our everyday needs. And we've reached the point of pretty much maximal occupancy of ventilators, maximal occupancy of NHS beds, and that's despite the fact that we have stopped elective surgery and run down services that are deemed non-essential and non-related to COVID, and are doing our very best to avoid other people coming into hospital. So it shows you that there is an overall reduction in capacity of beds. Now, that's gone along with, as we've talked about before, the privatization initiatives, the redevelopment of hospitals with ever fewer number of beds, the selling off of cottage hospitals and land, and the PFI initiative. So all of this is designed to push the NHS in the direction of privatization, an insurance-based model akin to the United States. It's very interesting. I saw a Stanford-trained US doctor. Again, he's not an infectious disease specialist, but he's very active on social media and actually issuing almost a manifesto demanding that this crisis was showing that their insurance-based system was not fit for purpose. They had doctors who had demanded better PPE and spoken out about the lack of PPE in the States being sacked. And the medical community are up in arms that they are being run as a massive industry whose object is to make money and not care for patients, and physicians are suffering. And really, this is the situation that the NHS is being driven towards and is already showing signs of.
But that'll have to stop now, Doctor. The Tories could not dare now propose further privatisation of the National Health Service. In fact, it'll be very difficult for them to resist demands for the renationalisation of some of the privatisation of the NHS. They cannot go towards an American system that is collapsing in front of our eyes, and even Donald Trump is talking about bringing in an NHS.
Our ruling class is very cunning, George, and there's no question. I mean, even the Financial Times is printing articles in which they're saying, if you like, a peak globalization is over. Yeah. That there's no way that the population of the world will accept the continuing concentration of wealth in ever fewer hands and the marginalization and pauperization of vast swathes of the world's population. Well, that's already happened. But our government are very careful to preserve the elements of private medicine, to talk about buying in services, buying in tests, buying in beds from the private sector, buying in ventilators, buying in new ventilators, commissioning industry to help to throw huge amounts of money at failing businesses and industry, failing because they've impoverished their market and their market is no longer able to buy the products that they make. So an inherent crisis which has been happening since the 1840s and in ever increasing numbers, and we've never really come out of the crisis of 2009. So that's the economic situation we're facing. Our government is very keen to avoid talk of privatization, to avoid talk of requisitioning, and they're throwing huge amounts at industry in order to try and paper over the cracks. It is up to us. It is up to us. Keir Starmer, recently, you've been talking about him on the show, he's very recently it's been announced that he's won the Labour election. He's already saying, how has he pitched himself? He wants to form a national unity government. He wants to enforce stricter measures on the people to make sure they stay at home. So shifting the blame is already a sign of shifting the blame away from the government. And with the cooperation of a new Labour-type administration, shifting the blame for the death toll onto the behaviour of British citizens. Of course, if we tested adequately, if we had taken appropriate measures to find out who had the virus and to stop it spreading, we wouldn't be in this situation. The economic crisis is not caused by people's behavior. It's not caused by the virus. It's caused by an inherent problem of our economic system. And I'm afraid to say that the new Labour administration show every sign of joining with the Tory administration in order to change that narrative and do their best to preserve the status quo. It will be
well, I don't know about that. He's got the support of Red Ken Livingston, surprisingly, on the show this evening. Dr. Ranjeet, thank you, as always, for a wonderful tour of the horizon. Let's take a quick break, 1 minute.
Radio Sputnik.
Tune in every Wednesday to Loud and Clear with Brian Becker and John Kiriakou for a regular segment called Beyond Nuclear, where Brian and John discuss nuclear issues, including weapons, energy, waste, and the future of nuclear technology in the United States, with Kevin Camps, the radioactive waste watchdog at the organization Beyond Nuclear. Listen on Wednesdays right here on Radio.